Okay, so let's talk about ADHD. Hi, my name is Raquel Alcantar, and my group and I are going to be discussing ADHD, specifically sex differences in ADHD. So, what is ADHD? Attention Deficit Hyperactivity Disorder is a neurodevelopmental disorder that is characterized by impairing levels of inattention, hyperactivity, and impulsivity. Overall, it affects about 5% of children. So it is very common among children. So, what are some sex differences in ADHD? ADHD is more prevalent among boys. ADHD has been primarily studied in boys. Teachers have tended to report boys as more inattentive, impulsive, and hyperactive than girls. Females are more likely than males to show symptoms of onset around adolescence. Early adolescence is a specific window for vulnerability of these symptoms, and males and females show differing ADHD developmental trajectories over time. So this creates differences in diagnosis and treatment due to the differences perceived in males and females with their ADHD differences, their treatments and diagnosis are affected. Sex differences in the phenotypic expression of ADHD are often proposed as an explanation for greater rates of ADHD diagnosis in males. So, what are the overall specific differences between them? We can break them down in males and females. So, for males, ADHD is more commonly diagnosed, but it is dependent on sample types with higher male to female ratio studies. Studies show sex differences in the pattern of ADHD treatment, with males being more likely to receive ADHD medication than females, meaning they are recommended at a higher rate to be prescribed medications, as well as in general just receive a diagnosis due to their behaviors compared to females. So when we are looking at females with ADHD that show predominantly inattentive symptoms and lower levels of disruptive behaviors may be less likely to receive a diagnosis of ADHD. So, females with ADHD are less likely to have learning difficulties or manifest these problems compared to males, which would also lead to a lower identification of ADHD in females. So, girls with externalizing symptoms were referred at a younger age because of their similar behavioral problems, which is considered out of the norm for females. Thank you for your time, and here are my resources to continue to research further sex differences in ADHD. Thank you.